Greg Vidal. I'm a breast medical oncologist at the West Cancer Center and Research Institute. I'm also scientific advisor for the West Cancer Foundation. I am the director of clinical research at West. I spend most of my time in clinic treating patients with breast cancer of various types. Memphis had the designation from, I think, a 2013 study done by the Avon Foundation as having the largest mortality disparity in breast cancer of the 25 largest cities in the United States. That was very eye-opening. Part of the issue had been the way medicine is conducted in the Memphis area. Most of the care is in sort of pay-to-play type institution. If you don't have coverage, you can't get treatment. And unfortunately, the minority population is the lower socioeconomic population. And so I think that reflected on the care. When we had a collaboration with the healthcare systems and the university, there was an effort made to try to close those gaps, bringing mammograms to areas that previously really it was more difficult to get it. There were community organizations and advocates that came together, external companies, pharmaceutical companies got involved. Some of the larger non-profit organizations also got involved. The West Cancer Foundation also got involved and started working on, first of all, trying to understand really what is the root cause of that, and then trying to then institute solutions. We have over the time improved. We're no longer number one. We're number 7 or 8, but it's still 7 or 8 is still not good enough, and it's something that we have to continuously work on. We cure breast cancer if we can find it early. If it's late, your cure rate decreases. If it's already left the breast and spread to somewhere else, we can't cure it. We can treat it, but we can't cure it. So the goal is to find you very early, and that's how mammogram is. Mammogram makes us find this cancer early so we can deal it, treat it early and cure patients. So one of the efforts was to increase the screening, but not only increase screening, but bring in screening to the patients where they are, in neighborhoods that didn't have access to screening, where a patient have to take 3 or 4 buses in order to go somewhere to get a screening. Let's bring it to the community through mobile mammogram. And West had been involved in that for many years, and a lot of detection. We've detected a lot of cancers as a result. What the West Cancer Foundation has done is make that a core part of what they do. How can we bring access to that population most affected, that population who's most likely to not have the coverage, not get the access. And so that's been a focus of the West Cancer Foundation. And an even bigger part of that is research and understanding where we are in Memphis, what are the problems, and finding what are the potential solutions.